We're going to start off with Michael Kidd, who's now in his new role, which opens him up to all sorts of questions beyond possibly what he's talking about. But as he said to me earlier, he's only been in the role for 6 days, so we better give him some time and space. I've known Michael a very long period of time. He was at Flinders as the Executive Dean. He's been the President of Wonka. He did a lot of work in HIV in the early days in terms of attitudes and care sort of services provision. And he kind of helped to save the college of GPs in a very difficult time when we were financially challenged. I described some of Michael's ability as having no Napoleonic vision. So he could see how all the bits would work, and he had a great ability to delegate and make things happen. So the college became very productive under his role. So Michael is going to talk about vaccine hesitancy and misinformation, disinformation, and the effects on vaccination rates. Can we welcome to the stage Professor Michael Kidd?
Thank you, John, and thank you very much to everybody for the invitation to come and join you today. Can I just check everyone can hear me okay? Yep, thank you. And it's a real pleasure to be here with you today. My thanks to John in particular as the chair of the session. As many of you all know, John's had a lifetime commitment to supporting improving vaccination rates and other preventive health measures across Australia to the benefit of the people of our country. So thank you to John, thank you to Rod and all the members of the Immunisation Coalition. Thank you also to everyone who's joining us. I've just looked and we have 250 people online, even more at the start of my talk. I hope that we don't have 8 online by the end of my talk, so please keep your cameras running. But before I begin, I'd like to acknowledge the traditional owners of the lands on which we meet, the Kaurna people, and pay my respects to elders past, present and emerging, and extend those respects to all First Nations people who are in the room here with us today. I'm very fortunate. I live on Kaurna land. I live in a rural coastal village called Carrickkalinga, which is about an hour south of Adelaide, and it's very quiet during the year. It becomes Adelaide by the sea during the summer holidays, but it's a wonderful place to live. And Carrickkalinga is a Kaurna word. It means the place where you go to find the reeds which you use to weave fishing nets, which was used by the Kaurna people as part of their hunting and gathering tradition. I'd also like to acknowledge the contributions of the members of the Australian Government Department of Health, Disability and Ageing, and we have David Laffin here today. Members of the department have assisted me in preparing this presentation. And also like to acknowledge Professor Christine McCartney and the team from NCEAS, and I know that there are some NCEAS folk here for providing me with advice and wisdom in preparing this talk as well. I am keen to know who's here. I'm not sure if we've done this already today, but if you're a nurse, could you put your hand up for me? Fantastic, the vast majority. I can't see those online, but I assume we have a similar large number. That's about 80% of the people in the room. Any doctors who are willing to put up their hands? Yeah, okay, thank you. My peers, and I know some of you are my peers in general practice. Other healthcare professionals who are here with us? Wonderful, thank you. And researchers, who's involved in research? Fantastic. Who's a manager, an administrator, making things happen, keeping our health system running? Thank you very much. Consumers? Probably all of us, I guess, but yep, thank you. And industry, we've got some people from industry here as well. Thank you. Have I missed anybody? Hopefully you've all had your hand up. That's great. Thank you. Thank you for the work that you do. And thank you for the contributions that you all make every single day towards ensuring immunisation rates for our population. And we're going to talk about what's happening with vaccine hesitancy and misinformation. Now, a lot of the other speakers have spoken about this today as well. Because you work on the ground, you know that and work directly with members of the population, you all play a critical role in tackling infectious diseases here in Australia. And I know it's not news to you that we have one of the world's best and most comprehensive national immunisation programs here in Australia. But and the benefits you can see here on this slide, since the introduction of vaccination for children in Australia in 1932, the deaths from vaccine-preventable diseases have fallen hugely. And the number of deaths that we now see from vaccine-preventable diseases is very small, but sadly, we still do see some deaths, particularly in those who are where there may be delays in getting medical advice and hospitalisation. Now, this is, as John said, my 6th day in the role as Australia's Chief Medical Officer. And it's notable that this is my very first presentation as your CMO, and I'm really pleased that my first presentation is actually talking about vaccination, immunisation, and what we can do to boost our rates here in Australia. You can also see that the Australian government, through our national immunisation program, invests more than $1 billion to supply the 31 current free vaccines that are available, tackling 18 vaccine-preventable diseases, protecting eligible people from birth to older age. And we've had a lot of discussion about different vaccines today. I've just become eligible for a free shingles vaccine, so you can all work out exactly how old I am. And I'm really looking forward to going to my general practice and having my GP nurse, who's wonderful, administer that vaccine to me in the next couple of weeks. Now, we have some of the highest coverage rates in the world, and that's thanks to all of you, thanks to all our colleagues, thanks to our predecessors who've worked on this in the generations before us, and more recently thanks to our National Immunisation Program, which you all know as the NIP. The NIP was established by the Australian Government and the state and territory governments back in 1997. And the aim of the NIP was to increase vaccination rates and help to reduce vaccine-preventable disease. And over the years, as I mentioned, it's continued to grow. We also have the National COVID-19 Vaccination Program, which currently sits outside the NIP and which complements the NIP by providing the free COVID-19 vaccines, and we've heard some of the challenges with that program sitting outside today as well. But these two programs are essential elements of our national approach to protecting the health of the people of our country. And of course, vaccine safety is a top priority as well. Now, as we all know, all therapeutic goods carry with them potential risks, some of which are minor, but some which could potentially be very serious. And that's why it's really important that all medicines, including all vaccines in Australia, go through the Therapeutic Goods Administration's rigorous assessment processes before they can be registered here in Australia. And with its scientific and clinical expertise, the Therapeutic Goods Administration makes sure that the vaccines that are approved for use in Australia meet the high standards of safety and quality and efficacy. And it also ensures the benefits of a product outweigh any risk associated with that product. Now, the work that the TGA does, I imagine most of you know this already, but their assessment looks at clinical trial data, it looks at the ingredients in each of the vaccines, the chemistry, the manufacturing, and also addresses and assesses vaccine-related concerns that have been supported by credible evidence. Quality and safety assurance doesn't just stop when a product is approved. The quality of every batch of vaccine coming into the country or being manufactured in the country is checked before it can be supplied. And even after vaccines are supplied and given to people in Australia, safety continues to be monitored. Our National Vaccine Safety Surveillance System has two components. The first is passive surveillance, and that's overseen by the Therapeutic Goods Administration, and that relies on us. It relies on individuals, health professionals and others reporting any suspected adverse events or side effects directly to the Therapeutic Goods Administration. Can I just have an indication? Anyone who's made a report on a potential side effect or adverse event of vaccines? Yeah, thank you. Thank you for doing so. And if you notice something, please notify it. because you may actually be the first person who is raising a possible concern, and we need to know about it. The second way that we look at surveillance is through active surveillance, and that's through the vaccination program administered by NCIS, the National Centre for Immunisation Research and Surveillance. And vaccination actively seeks information directly from people who've received a vaccine or from their parents or carer in the case of children. And the Therapeutic Goods Administration also regulates vaccines through the licensing of our Australian manufacturers and ensuring that overseas manufacturers are complying with the same standards as their Australian counterparts. Now, if a problem is discovered with a vaccine or with a manufacturer, Therapeutic Goods Administration can take regulatory action, and this can be from continued monitoring all the way through to withdrawal of a product from the market. So we've got a lot of checks and balances here in Australia to make sure that our vaccines are as safe as possible, and I think that's really important to understand. Now, unfortunately, despite having one of the world's most comprehensive national immunisation programs and a world-class medicine regulatory framework, we are seeing a decline in vaccination rates, as you are all very well aware and as we've had discussed this morning and as Minister Butler discussed in his presentation yesterday here in Adelaide as well. Our coverage is still high in comparison to many other countries, but since 2020, our vaccination rates have been declining, and they've now fallen short of the 95% coverage target across most cohorts and across most vaccines. And unfortunately, First Nations people are disproportionately affected when we look at these reductions in figures. And what this means is that we're not maintaining the numbers that we need to achieve herd immunity, that protection which we provide to everybody in our community through having high rates of vaccination. And that means that our community becomes more vulnerable to outbreaks of diseases which have previously been eliminated in Australia, like measles. We've also seen more cases of influenza and whooping cough, as we saw in the presentation this morning from Rama. Right now, very concerning, we've actually seen outbreaks of polio in Papua New Guinea, just to our north, and of course we have a very close border with Papua New Guinea and the Torres Strait Island region. Now, to tackle this challenge, the Australian Government and the states and territories are providing regular updates to the public, and we're publishing news items, statements encouraging vaccination and emphasising the importance of on-time vaccination for children through the National Immunisation Program, of catch-up vaccinations for children and adults where appropriate, and you're all involved in those schemes as well, of getting relevant vaccinations before travelling overseas, which we were talking about during the break, and providing nationally consistent information to us as healthcare providers and to the public. And if we don't halt the decline in vaccination rates and improve our vaccination coverage, we all know what we're risking. We're risking more disease outbreaks, we're risking more serious illness, and we're risking death among members of our most vulnerable populations, including our children and older people. Now, there are two main factors that are driving vaccination decline here in Australia. The first is access barriers, which again you'd all be aware of. And this includes the practical difficulty of actually accessing an immunisation service. It could be that it's hard for people to find a service and make an appointment. It could be that people are unable to meet the cost of an appointment, or for those living in particularly rural areas, the cost of travel to get to a place to get your vaccinations. People may live a long way away from where vaccination services are available and don't have the transport to get there. There can be language barriers for people where English is not their first language, and that particularly affects new arrivals to Australia, many refugees. And there are many reasons why people might struggle to access a service. And we have programs in place to try and address many of these barriers. The current triple bulk billing incentives aim to encourage GPs to bulk bill children under 16, and of course we have other measures coming in under the election promises. We're working with states and territories to offer free nurse vaccinations for many children, and the Vaccinations in Pharmacy program allows eligible patients to get NIP vaccines through their local pharmacy if they're participating in the program. The second main factor is acceptance, and the acceptance barriers include someone's thoughts or their feelings about vaccines, or societal influences or social media influences which have an impact on people's decision about their acceptance of being vaccinated or having their child vaccinated or their elderly parent vaccinated. And it could be that an individual believes that vaccines are unsafe or ineffective. They may have concerns about getting the disease from the vaccine. I'm sure you've all encountered that at some stage, with people worried about actually getting infected by having a vaccine, or they just don't trust the information which is being provided, coming from sources like government and health providers and health professional organisations and so forth. The National Centre for Immunisation Research and Surveillance, NCIRS, puts out the National Vaccine Insights, and this program identifies many of these barriers among parents or carers that affect whether a child ends up getting vaccinated or not. And for COVID-19 specifically, the Senate Select Committee on COVID-19 found that misinformation and complacency were the leading barriers for people not getting vaccinations. And of course, vaccine hesitancy and vaccine refusal are complex, and misinformation and disinformation play a part, and a big part, both here in Australia and globally. The World Health Organization has named vaccine hesitancy as one of the top 10 threats to global health. So it's not just here in Australia, this is a global health issue. And misinformation and disinformation lead the top short-term global risks in the annual World Economic Forum report on global risks, which is not just health risk, it's risks in general. The National COVID-19 Response Inquiry that we had here conducted over the last year or so identified trust as a key priority for government. And the inquiry has also recommended that we need to develop a national strategy to rebuild our community's trust in vaccines and to improve vaccination rates. And that's something that I'm particularly looking forward to working on, with input hopefully from everybody taking part in this forum. Now, it's important to understand the difference between misinformation and disinformation. The key difference is not the information itself, it's the knowledge and the intent of the individual who is sharing the information and sharing that with others. Misinformation is the spread of false information without the intent to mislead others. And those who share misinformation may actually believe that what they're saying is true or useful or interesting to the people who may be reading what they share. In misinformation, there's no malicious intent towards the recipients that are having that information shared with them. Disinformation, on the other hand, is the spread of manipulated information with the full knowledge that what is being shared is false. And the intent of disinformation is to deceive other people and to cause harm. And the reasons that people spread disinformation are many. It can be for personal or monetary gain, for ideological or political reasons, or simply to get more followers on a channel in social media. And regardless though, both misinformation and disinformation can cause harms. And it's becoming increasingly difficult for us to know who to trust. And that includes for those of us who actually have the knowledge and know what's out there. We are all subjected to different sources if we're accessing social media of misinformation and disinformation. And here are some examples. One recent example of damaging misinformation was the claim that COVID-19 mRNA vaccines were contaminated with excessive levels of DNA. And last year, the Therapeutic Goods Administration had to issue a media release stressing that this was not the case, that COVID-19 vaccines in Australia have been rigorously assessed and they meet our high standards of safety and quality and efficacy. But the rapid and extensive spread of vaccine misinformation online, mainly through social media, can be overwhelming. And as we all know, trying to catch up with information once it's out there can be really, really challenging. So this represents a major challenge for governments and for many of us as health professionals. The goal that we have is to ensure that people get accurate and evidence-based information while maintaining confidence in our immunisation efforts here in Australia. And so we all need to be working together, which is why the coalition is such an important part of our national work and national responses. We need to work together to coordinate comprehensive communication strategies across governments and jurisdictions. We need to re-establish trust through transparent and balanced information. We need to equip you as health professionals with the tools that we need to support conversations with our individual patients. We need to build relationships and engage with communities through trusted local voices. And of course, as health professionals working in your communities, you are a trusted voice. People trust you, they've got to know you over time, and especially for those of you who are nurses, you've been delivering the vaccines to children throughout, and often through whole generations and then successive generations. So people trust you. The Commonwealth and the state and territory governments are committed to continue to work with health professionals to provide reliable and up-to-date information that you need to combat the growth and impact of misinformation and disinformation. Now, at the Commonwealth level, we're tackling declining vaccination rates on a number of fronts. We're running immunisation campaigns, we're promoting trusted sources of information, we're promoting voices of authority. We have a review of the National Immunisation Program currently underway, and this aims to quantify the burden of vaccine-preventable diseases in Australia and will help us to further understand the economic impact of vaccine-preventable diseases and the direct and indirect health benefits to the people of our nation through vaccination. It will also support developing an economic model that will help to inform future funding decisions, and we've alluded to funding decisions in the panel discussions earlier in the day. Dr Anna Peet, who is the head of the National Immunisation Division in the Australian Government Department of Health, Disability and Ageing, recently met with Australia's chief scientist to discuss Australia's declining vaccination rates and vaccine misinformation. And the chief scientist is supporting Australia's National Science and Technology Council to deliver advice to us all on what makes people susceptible to believing misinformation and disinformation or not believing it. And then how can we use that to develop and identify evidence-based interventions which will help us to tackle misinformation and disinformation. The knowledge doesn't just rest with us as health professionals, it rests in those who are experts in communication, in the use of media, in getting powerful messages across and understanding societies. And so what we're looking at also is how we can improve the ability of individual Australians to identify false or fabricated information themselves, whether it's about vaccination or about other key issues, and to reduce our susceptibility to believing falsehoods. During the lunch hour, I got a call about someone wanting to help me with my Telstra broadband and wanting details of my laptop. It happens continually, and it really worries me and concerns me that there are elderly people out there who are starting to decline a little bit, who are deliberately targeted prey. I mean, it's probably why I got the call, because you now all know how elderly I am. And I'm probably now on a list for some of these malicious groups around the country. We're also partnering with NCEARS on the Sharing Knowledge About Information website, and this website provides evidence-based information, answers common questions and supports conversations between Australians and their trusted health professionals. The Department of Health also took part in CSIRO's Trust in Science and Technology event that was held in Brisbane last month, again bringing together leaders in science and policy and technology, again to look at this issue of public trust and misinformation. And a new coalition has been established to actually tackle this at a national level. We also have a lot of resources available on our website during the pandemic. We're recommending people go to health.gov.au as the single source of truth on information. That remains the same, especially for immunisation, but of course you also have resources in your individual states and territories as well. But we want to make sure people have ready access to reliable, official, authenticated, up-to-date and evidence-based facts and recommendations. And we'll continue to work with communities and strengthen partnerships to understand these sources of misinformation, to identify who are the trusted voices and leaders who can encourage people to make informed decisions about vaccination, and that includes you. And of course, Minister Butler yesterday, with the launch of the new National Immunisation Strategy 2025 to 2030, this will guide our work over the coming 5 years, and this is built into the strategy, which highlights that building trust and acceptance of immunisation is a national priority area to increase vaccination uptake and get optimal coverage rates. So in conclusion, I want to thank the Immunisation Coalition again for inviting me to speak today and deliver my first public address as the nation's Chief Medical Officer. It is wonderful to see so many of you coming through and coming together for this important forum. I hope we still have 300 plus people watching online. Nobody's left the room, thank you. I'm also, I don't need to tell you how important this issue is for public health. Immunisation, vaccination is one of our greatest medical advances and achievements. It's one of the most powerful tools that we have to protect the people of our nation. We know through the WHO that vaccinations have saved over 150 million lives over the last 50 years from 14 different diseases, and most of those lives saved have been in small children. So thank you for what you're doing. We can't accept current vaccination rates. The risk is too great. We've got to keep working on this, and this issue is at the top of my priority list as the Chief Medical Officer. You're all in a fantastic position to do something about this. Please continue to do all you can. Please continue to share the messages, because it's only by working together that we're going to turn this around and make a difference for the people of Australia. Thank you.